Okay, Baltimore City Council Ways and Means Committee, we are back in session. City Council Ordinance 22-0235, Ordinance of Estimates for the fiscal year ending June 30, 2023. I'm Eric Costello, Councilman from the 11th District, Chair of the committee. I'm joined to my right by Councilwoman Felicia Porter, 10th District, and I'm joined to my left by Councilwoman Odette Ramos, 14th District. On behalf of Council President Nick Mosby, we have Nate Poole and Matt Stegman. On behalf of Mayor Brandon Scott, we have Nina Themlis, Sophia G., and Natasha Mehu. To my immediate right is Marguerite Curran, staff to the committee. We are here to start off day 6. We have Health Department up. Dr. Jiraza, what we're going to do is as follows. First, I'm going to have you introduce your senior team that are here, and you're welcome to introduce any other personnel. I'm going to ask you to provide their first and last name, as well as their title and what division they run or are the deputy of, et cetera. Folks, when Dr. D calls your name, please raise your hand. Then we're going to jump into your presentation. I understand you have 20 or 21 slides, plus or minus. I'm going to ask you to keep your presentation to about 20 minutes. Folks, when you're talking into the phone, you are in the microphone. You're welcome to take your mask off. What I ask, whether you have your mask on or not, is that you're about one hand length away from the microphone. Someone this morning is inevitably going to mess that up. It has happened at every single agency hearing so far. It's going to happen multiple times during your agency hearing, and it will happen for every other agency for the duration of the day and the week. I will politely interrupt you to remind you of that. The reason for that is that we are streaming this hearing live on Charm TV's website, as well as the hearing is being archived on Charm TV's YouTube channel. So with that, is everyone good with the agenda and flow? All right, Dr. D, take it away.
Good morning. Thank you, Chair. I will start with introductions. I have Deputy Commissioner Mary Beth Haller of the Division of Youth Wellness and Community Health, Deputy Commissioner Jennifer Martin, Division of Population Health and Disease Prevention, Deputy Commissioner Hyung Tan, Division of Aging and Care Services, the Deputy Chief of Staff Kelly Eastman, Chief of Finance and Administration Leslie Thompson, Assistant Commissioner Francine Childs of School Health Services, Assistant Director Mark Mason of our Youth Programs, Director Kathy Watson of our Adolescent and Reproductive Health and Immunization Programs, Director of Strategic Initiatives Kathy Costa and Maternal and Child Health, Acting Assistant Commissioner Lalisha Childs of Communicable Disease and Outbreak, Assistant Commissioner Dr. Adina Greenbaum of Clinical Services and HIV Prevention, Director Mary Grace White of Acute Communicable Diseases, and we also have support from Behavioral Health System Baltimore, Vice President Adrienne Bridenstine of Policy and Communications, Vice President of Operations Lynn Muma, and Director Daniel Rabbit of Policy. With that, I will go ahead and get started. So again, good morning. My name is Dr. Letitia Jiraza, and I'm the Health Commissioner for Baltimore City. Thank you, Chair Costello, for this opportunity to present our budget for FY23. So as a department, we continue to focus on our role as the local health authority to provide a healthier community where all Baltimoreans can thrive. We remain steadfast in our commitment, and we actually had the honor of hosting the CDC director last week, Dr. Walensky, to discuss national public health priorities and particularly a focus on core public health services. We also continue to implement an equity lens in the following areas: emergency preparedness and response, acute communicable diseases, environmental inspection services, field health services, our direct clinical services, school health, chronic disease prevention, substance use disorder, mental health support, support of our older adults, and support of our mothers, children, and continuing the ongoing COVID-19 pandemic response. I'd like to start with our Clinical Services Bureau, or Service Number 303, whose FY23 budget is a little over $17 million. This bureau includes our STD and HIV stationary and mobile clinics.
Doc, yes, I'm just going to turn the volume up one or two. Not on the mic, but your voice. Thank you.
Our internal lab is included in this, our TB clinic, as well as the dental services. These clinics serve approximately 16,000 patients per year and are often the safety net provider to some of our most vulnerable populations. The recommended budget includes $4 million in a federal grant for integrated HIV surveillance and prevention program, which is a program to prevent HIV infections and achieve viral suppression among people living with HIV. The budget also includes $5 million in general funds to support the Clinical Services Program, which provides access to preventative health care, diagnosis, and treatment for Baltimore City residents. Of note, we did see a decline in visits during the pandemic, but on a positive note, we have been distributing many more home STI test kits through our I Want the Kit program. To adjust and support the safety and wellness of our staff and patients, we are not allowing walk-ins. However, we have recently begun taking same-day appointments. Some additional highlights for the past year, including restarting our latent TB program in 2021. After having not been funded for 4 years, we were able to see 269 patients. This program is partnering with our family planning program, as well as city federally qualified health centers. In 2021, as I mentioned, we expanded to our I Want the Kit program that allows at-home distribution of STI testing kits, and also expanded our PrEP program, which allows for HIV prevention in high-risk individuals. Our sexual health clinics and dental clinics did continue to provide care to patients while implementing modified operations. The sexual health clinics had over 3,000 patient visits at our Eastern location and almost 900 patient visits at our Druid location. In addition, our sexual health clinics saw over 5,000 telemedicine visits in 2021. Moving on to our next service number 305, which includes our lead and asthma programs. During the pandemic, we did transition to virtual visits. Our child lead poisoning prevention partners work with providers across the city, for example, Maryland Physicians Care, to follow up with clients who have not been tested or those children who've not had appropriate follow-up testing. Alongside these partners, we reached out telephonically and by letter to encourage their children to get tested. We will be resuming on-site blood testing at our immunization clinic in July of this year. This budget supports vital lead and environmental inspectors, who conduct our license inspections and our home visits as certified community health workers. As a part of the statewide integrating health improvement strategy, our asthma home visiting program has received an infusion of funds that will increase services to children with uncontrolled asthma who receive or are eligible for medical assistance. This is an additional $600K for the FY23 budget, which will allow us to increase home visits through staff at 4 additional staff, 1 supervisor and 3 home visitors, and we'll be able to visit approximately 300 additional children. Next, I will review Service 307, which is Substance Use Disorder and Mental Health. I want to thank our partners at Behavioral Health System Baltimore, or BHSB, the city's local behavioral health authority, for being here today. BHSB, as I mentioned, serves as that local entity to provide oversight to the city's behavioral health care system. We partner with them in a number of ways, including our city's opioid intervention team, a multi-agency group that develops the city's 3-year strategic plan to address substance use disorder. As a department, we also secured an epidemiology fellow focused on data analysis of opioid use disorder, and in fall 2021, we updated our levels of care designation for city hospitals. We also have a mayoral fellow that started just last week who will be supporting landscaping of opioid services across the city. The recommended budget includes a little over $800,000 in general funds to support substance use treatment services to residents in Baltimore City. This includes, but isn't limited to, diagnosis, treatment, and rehab services for alcohol and drug abuse, individual, family, and group counseling, as well as intensive outpatient treatment and drug-free outpatient treatments. The recommended budget also includes $1.4 million in grant funds from the state's Opioid Operations Command Center to empower individuals to make safer choices as we help them identify programs that are effective at supporting substance use disorder. Next is Service 308, the Bureau of Maternal and Child Health. The Bureau of Maternal and Child Health, with a budget of a little over $24 million. This includes our work around supporting positive birth outcomes and addressing infant and maternal mortality disparities, our nurse home visiting programs, our infants and toddlers programs, our WIC program, family planning, and our infant and childhood and maternal mortality review boards. In January of 2021, this bureau launched the Baltimore City Maternal Mortality Review Team in conjunction with our Fetal Infant Mortality Review Team and the Be More for Healthy Babies initiative to eliminate unjust disparities in maternal morbidity and mortality and improve Black maternal health. To date, we've reviewed 2 years of cases, and the first report of recommendations will be published and disseminated to providers this fall. Additionally, there is a little over $500,000 in the FY23 budget to support nurse home visiting as a part of the Be More for Healthy Babies strategy, which to date has seen a 35% reduction in infant mortality since its launch in 2009. In January of this year, we also released a 5-year retrospective review of all childhood fatalities, including additional supports needed to continue the work. Our Childhood Fatality Review Team, or CFR, is partnering with the Mayor's Office of Neighborhood Safety and Engagement to prevent violent fatalities in children and youth, with the mayor dedicating $1.25 million in ARPA funds over 3 years to interagency collaborative efforts to identify children at risk and improve policies, services, and supports for those families. Next is Service 310, or School Health Services. This includes support of all our school health suites and school-based health centers in city schools. In addition to medication management, mental health referrals, case management, immunizations, and hearing and vision screen, our school health teams have also supported COVID screening and symptomatic testing for COVID for city school students. We did see a decline in visits in 2021 due to the virtual learning environment. However, we did support the learning centers that opened by city schools from September of 2020 through January of 2021. In February 2021, we saw the return of early learners, students with disabilities, and students in transition years. In mid-April, all students were scheduled to return, and throughout the school year, there have been a number of positive COVID cases and outbreaks among students and staff, and our school health staff has stepped up to support, providing case management and check-ins with students who have chronic health conditions, performing COVID screens at entry doors, evaluating sick students in wellness rooms, and providing quality assurance observations of COVID testing. Since the beginning of FY22, school health staff have collected specimens for more than 67,000 COVID tests. Next is Service 311, our health services for seniors. This includes our Adult Evaluation and Review Services Program, or AIRS, which evaluates residents in their home, older adults or adults living with disabilities, to determine if they qualify for medical assistance or support due to physical or medical limitation. This work allows residents to safely stay at home while receiving necessary service. There was limited disruption in this work during the pandemic, and the recommended budget includes $5.4 million in special revenue. Next is Service 315, which includes our Office of Acute Communicable Diseases, the Office of Public Health Preparedness and Response, as well as Field Health Services. As you can see, in 2020 and 2021, we performed significantly more outbreak investigations than normal, including investigating a hepatitis A outbreak that began in March of 2020. To date, the program has held over 11 hepatitis A vaccination clinics for at-risk populations, and we were additionally awarded a viral hepatitis grant from the CDC in 2021. This will include collaboration between our Acute Communicable Diseases Program, our Clinical Services Bureau, and our Community Risk Reduction Services Program. It allows us to conduct surveillance of hepatitis cases in Baltimore City and help link individuals to care, help have outreach staff that can conduct client engagement activities within our syringe exchange vans, and also provide care linkage and navigation. We were also able to expand hepatitis C point-of-care testing on our SPOT van. Our Field Health Service Program actually scheduled 44,000 transports in FY21 that supported over 2,400 medical assistance recipients here in the city. Additionally, this group is monitoring the current monkeypox outbreaks now in the U.S. Messaging has been shared with healthcare providers, and guidance has been provided to call intake points within the agency. The sexual health clinics have developed protocols and are planning for possible cases. A formal ICS structure has not yet been instituted, but we are coordinating and looking for triggers at the point at which we might need to stand up an ICS structure. Next, we have Service 316, the Office of Youth and Trauma Services. This service uses a public health and human service model to provide mental health referrals and other stabilization services to victims of violence and other residents impacted by trauma and violence. This service conducts citywide trauma trainings and violence prevention programs in our city schools. The recommended budget will allow the Youth Services Advocacy Project, or YSAP, to provide $80,000 in funding towards housing subsidies for 20 to 25 families in 2023, and an additional $80,000 will allow for implementation of the youth violence curriculum in 4 Baltimore City public schools in this upcoming fiscal year. The recommended budget also includes a little over $340,000 in general funds for the Healing City Act funding to support training and technical assistance for trauma-informed care training. This includes youth and trauma services, trauma-informed care training for city employees across, as well as nonprofits and other service providers.
Doc.
Yes, sir.
Volume up. Thank you.
This work was implemented last year with the Enoch Pratt Library Systems and will expand to Baltimore City Recreation and Parks, as well as other agencies in FY2023. Next is Service 715, or administrative costs. This includes our executive leadership team, external affairs, fiscal services, human resources, facilities and maintenance, grants and policy development, and epidemiology and planning. Administration provides departmental leadership, facilitates and guides the agency's deliveries of services, and ensures agency compliance with city, state, and federal laws, procedures, and standards. The recommended budget includes $8.5 million of unallocated grant funding to accommodate additional federal, state, and special funding that may become available. Now we have Service 716, the Office of Animal Control, that maintained operations throughout COVID despite limited staff. Barks and Animal Control work together to limit the number of animals entering shelters by providing resources to owners to assist with foods, vaccination, and other medical needs. The partnership will continue in order to keep more pets with their families and an attempt to only intake those animals that are truly in need. Funding for resources is crucial to continue to decrease the number of animals entering the shelter each year. Additionally, Animal Services also regularly partners with agencies such as BPD, Housing, and the Housing Authority, as well as nonprofits to approach cases involving multi-occurring issues and concerns within a household. Next is Service 717, or Environmental Inspection Services, which also partners with other agencies, including Housing, BPD, and Fires, to conduct joint investigations and participate in the Social Club Task Force, as well as the Multi-Agency Coordinated Inspections Task Force. This collaborative approach enhances the safety and health of our neighborhoods, and the recommended budget provides funding for our EIS, or Environmental Inspection Services, which includes food control, ecology, and institutional services, and the Plan Review Program. Together, these work units license and inspect food facilities, schools, swimming pools, institutional facilities, and tattoo operations to ensure that health and safety requirements are met. Service number 718, the Office of Chronic Disease, focuses on health promotion and disease prevention. Our health promotion programs aim to engage and empower individuals and communities to choose healthy behaviors and to make changes that reduce the risk of chronic diseases and other morbidities. Disease prevention focuses on specific efforts that reduce development of those severe chronic diseases, such as tobacco cessation support. So we gladly support the Tobacco-Free Baltimore. This also houses our Baltimarket, or our virtual supermarket program, the Diabetes Coalition, and the Baltimore City Tobacco and Cancer Coalition. The recommended budget includes a grant funding from LifeBridge to expand our virtual supermarket program services to 9 to 10 sites in West Baltimore. The virtual supermarket currently provides food access to 9 senior centers located in areas with low food access. The program is geared towards educating city residents on healthy food choices with dietitian-led classes with specific topics of interest such as diabetes teaching and hypertension management. Of note, our virtual supermarket continued its operations throughout COVID, providing a much-needed source for food access for many older adults. We also resumed tobacco compliance checks in February 2021. Our staff, along with Black Mental Health Alliance, conducted 310 visits in the following areas of Baltimore City: Pimlico, Arrington, Southern Park Heights, Upton Druid Heights, Old Town Middle East, Southwest Baltimore, Cherry Hill, which included following up on calls from concerned citizens. Service number 720 includes HIV treatment and prevention, community risk reduction services such as the syringe exchange program, provision of care management or case management to residents living with HIV, and our Ryan White program, which supports comprehensive care for HIV-positive residents. Through this program, we have been able to achieve viral suppression rates of 90% among residents that we serve, which is higher than the national average of those living with HIV of about 66%, and higher than all Ryan White programs at about 85%. Through successful competitive grant funding, the Baltimore EMA successfully competed for the Ending the HIV Epidemic grant, creating a program, Getting to Zero Plus, to engage clients who have fallen out of care or given up on care. With this program, we're providing additional supports to those who need additional assistance to remain in care and become virally suppressed through medication adherence and regular attendance to clinic. The Care Quality Management Program has created a number of vital community health department partnerships that allow the development, execution, and analysis of community-developed and led projects to enhance HIV viral suppression and care management. Looking at our Community Risk Reduction Services program, through this team, we've conducted over 1,500 naloxone trainings and trained over 4,300 residents as a part of street outreach. In 2021, 1,300 overdose reversals were reported to our program from individuals who received our naloxone training. The HIV surveillance and disease surveillance programs have worked to identify and investigate an increase in congenital cases of syphilis in FY2021, some of that work having been impacted by the recent cyber incident at MDH. Service number 721 includes support to city-run senior centers and those run by nonprofit partners. This budget includes $65,000 in funding for a center director to oversee the Zeta Center. The Zeta Center is in a particularly vulnerable community in Park Heights, with 21% of the older adult population living at poverty level in the surrounding area. Capital improvement projects to the Harford Road Senior Center are underway with the support of additional state and city general funds, and our senior centers were able to safely reopen for in-person activities in July of 2021. They remain a focal point for services, food access, vaccine administration, and sometimes COVID testing for older adults and their families. They also operate as cooling centers during extreme heat days. Service number 722, Administration and Care, has been consolidated with Service 715, Administration Health, and all general fund support has been removed from this service area. Remaining funding is from a federal grant, and once this grant is completed in FY23, this service will be fully consolidated with Service 715. Service 723, Advocacy for Seniors, encompasses support of our older adults as well as their families, caregivers, and adults living with disabilities, and this includes our MAP call center, which connects older adults to resources in the community, and our Ombudsman program. Our Ombudsman program was the first one in Maryland to go back into the field as nursing homes and assisted living facilities emerged from pandemic shutdowns. Our program is increasingly recognized as a leader in the state in terms of effective advocacy. The Maryland Access Program, or Point rather, as well as has been an access point for older adults and their caregivers, and we've received over 100,000 calls since the pandemic began in March 2020. Our plan is to have the community health workers from MAP housed in our senior centers to increase community access to the important service on-site and in person. During 2021 Medicare open enrollment, the State Health Insurance Program, or SHIP, responded to calls from hundreds of Baltimore City Medicare beneficiaries whose coverage under Hopkins Medicaid Advantage Plan was discontinued. Our staff and volunteers help those residents find new plans or transition to traditional Medicare. Next, Service 724, which includes our Adult Public Guardianship Program, is responsible for providing oversight and care for over 200 court-appointed older adults who rely on the city for medical and housing decisions. This program will expand its case management services through support from ARPA. Service number 725, our Community Services for Seniors, provides a number of resources to older adults, including meals, food boxes, health education, and transportation. Due to increased food insecurity and demand for food resources, ARPA funding will continue to support ongoing food programs, including home-delivered meals, congregate meals, and home-delivered food boxes. The budget also funds the Family Caregiver Support Program, which supports both individuals caring for older family members and grandparents caring for their grandchildren. The program provides financial assistance, respite care, and partners with nonprofits and community organizations to provide additional resources to these families. Looking ahead to our ARPA funding, we received an award from the Mayor's Office of approximately $80 million over the period of performance. and this will cover FY22 to FY25. This will continue to support our ongoing response to the pandemic, and for FY23, the budget that's been allocated is a little bit over $26 million. This next slide provides further breakdown of proposed spending for FY23. As you can see, we'll continue to support contact investigation and contact tracing, though there is a plan to gradually decrease the number of staff providing that support. We will also continue to provide vaccination support, as well as contractual services that include vaccination and testing sites. And that completes my presentation.
Doc, thank you very much. One, I want to thank you for your leadership throughout the pandemic, especially on the business roundtable meetings that we've been having for the past 2 years with Shalonda Stokes. Really appreciate that opportunity to pick your brain and bring questions to you and get answers and bring those back to the business community. Comment number 2, Mary Beth, I want to thank you for just the outstanding service, responsiveness to my constituents. I deeply appreciate it. I know that when I call you, the situation's going to get taken care of, so really appreciate that. I will come back after my colleagues. I do have some questions around PHSB, as well as an issue we talked about last year, dealt with dead animal collection, if you will, or cleanup. I'm not sure how to refer to that appropriately. And also want to talk a little bit about the Animal Control Board. With that, Councilwoman Porter.
Sure. Dr. D, I just want to echo what Councilman Costello, was talking about. I think you have exemplified excellent leadership, you and your team, the entire health department throughout this pandemic. I think that Kelly Eastman, I think you are amazing. The chief of staff is one of the most hardest positions in a department, so I just wanted to shout you out. With regard to, I have a few questions. So let's start with Service 310. If we can go back to that real quick. It was at the beginning, yep. Cool. So there is, as we know, there is a shortage of school nurses all throughout the nation. And I wanted to know, have you all thought about using community health workers and paraprofessionals to kind of bridge that gap with kind of like what the school nurses can do? Because the only reason why I bring that up is because chronic absenteeism is a major concern in Baltimore City Public Schools, and one of the issues that parents are raising are about technical assistance, are about medication delivery and things of that nature. And I know, I'm not sure where you all are with the health corps, with the community health workers, the 300 community health workers, and I'm wondering if that particular entity can kind of bridge that gap between medication delivery, explaining like medication assistance and technical assistance to parents with the child being at home.
Sure. So maybe I'll start, and we do have Assistant Commissioner Francine Childs here. So I want to publicly thank our school health staff who have gone above and beyond this school year with all of their support. What I didn't mention is that many of them, when schools were closed, supported COVID testing sites. And so they have been really instrumental, I think, in our overall ongoing pandemic response. So that is school health services is really kind of a state mandated and regulated program. Right. And so there are certain requirements in terms of nursing support and how they're able to delegate their responsibilities, such as medication management, to like a medical tech or a school nursing assistant. And so I say school health services generally, and I know I mentioned the nurses, but we also have school health aides that support in schools too. That again, nurses are able to delegate some responsibilities, but not all to those school health aides. I also want to just commend Assistant Commissioner Francine Childs, for her advocacy for this group. As such, we are able to provide bonuses and some salary increases for this group, which I think is particularly critical during this time. But I think, again, we're really trying to think of creative ways to support the staff that has stayed, as well as attract new staff, which will likely also include some media campaigns. So we do have some funding to support some additional media campaign around recruitment and retention. But certainly love your idea of using the Baltimore Health Corps, but I think just because of how that area is regulated, it would kind of have to stay within the purview of school nurses and school health aides. Certainly, Assistant Commissioner Childs, if I missed.
And my apologies, I should clarify. I was talking more about like a workforce pipeline from the community health corps to kind of school aides. So like, how like in phlebotomy, literally people start in the hospital on phlebotomy and they kind of go up.
I will say we do have that on a smaller scale. So like our school health aides, we can provide some support if they want to transition and go through nursing school to become nurses. I will say what I've heard is very challenging is trying to balance. Many of these individuals need to work full time.
Okay.
So trying to balance working full time with also being in school. But that there is support there. But I think it's just that balance for staff.
Okay.
Is that right? Maybe.
No, I appreciate that. No, it's good. I appreciate that. And I'm wondering, like, with the school health nurses, can they be an LPN? Do they have to be an RN? Like, what's the designation
we have LPNs
there?
as well. I think it'll just change what they're able to do.
What they're
in
able
terms
to
of
do.
functionality.
Okay.
Yep.
All right. And so my second question has to do with Safe Street. So love the program. I think it's a great program. However, one of the critiques that I have is kind of looking at while it's happening and also post, so tracking those metrics. Is that something that can be expanded to the Safe Streets model, like including ROCA, for having Safe Streets model, kind of doing that violence interruption, and then having some sort of like post feedback where we're tracking individuals for a period of time, like maybe with wraparound services? I'm not sure if that's being done already.
So Safe Streets is now in the Mayor's Office of Neighborhood Safety and Engagement.
Okay.
So we're not tracking how that's being evaluated.
Okay. So there's no collaboration there. So it has officially moved into Monty. Okay. I'll save my other questions. Thank you.
Thank you, Councilman Cohen.
Thank you, Mr. Chair. Thank you, Dr. Jurasta. And again, thanks to your whole team for really exemplifying what it means to take on a crisis and make our city better for it. I do want to specifically thank you around the partnership with the Healing City Act. Mary Beth, we've had a few moments, but she has been an outstanding partner, and it means a lot. And I'm proud to see the work and both what we've done in the library, what we're going to do in Rec and Park, and just to see it start to become a national model and have folks from Pittsburgh and Cleveland and Cincinnati and Toronto reaching out about what we're doing, I think speaks to that partnership and the way that your office is able to use leverage and support work that is driven by community. I think it's been really, really good what we've been able to do. That said, I remain very concerned that this next sort of phase of the pandemic is really going to be a mental health crisis. We see it in our schools, we see it with seniors, we see it in our streets, we see just the rise in overdose deaths, the really absurd amount of violence. Just seeing people who are struggling to de-escalate conflicts that are pretty minor and petty in nature and that result with someone shot and either in the trauma unit in the ER or dead. And so I am curious what we intend to do, just sort of the increased sense of urgency, knowing that one of the lagging indicators in any pandemic is a mental health crisis, sort of comes after, and knowing that not just in Baltimore, but in cities across America, we are seeing just really hurt people and not just physically hurt, but in terms of increased mental illness. So I wanted to ask specifically about that, what you need, what your office needs in order to directly address the mental health crisis that I believe we are currently facing.
Yeah, no, I appreciate that question, and I particularly appreciate that we have our partners here, BHSB, who I think their work on the Here to Help line and supporting BCRI as a primary resource for individuals experiencing an active crisis, I think remains critical to how we can support. I would say even discussing how we better advertise that and making sure that the city residents are aware that is even available to them at no cost. But I will turn it over to my partners at BHSB to talk about some additional supports and needs.
What microphone should I use?
You have to go on a microphone. Right here is fine.
Yeah, thank you for the question, Councilman. For the record, my name is Dan Rabbit. I'm the policy director at Behavioral Health System Baltimore. We couldn't agree more that we're facing a mental health crisis right now, at a level that we've rarely seen. We have seen overdose rates go up 30% year over year, and the most recent statistics that recently came out show that trend is continuing. And we're seeing a youth mental health crisis like we've rarely seen. So at Behavioral Health System Baltimore, we're working closely with our partners in city government and with our provider partners in the city to try to meet that need. Like Dr. Dorissa said, one of our key frontline services is the Here to Help hotline. We've seen the calls from the Here to Help hotline double during the pandemic, and that increase in calls has not leveled off at all. It's maintained that high level. So we have been supporting VCRI to try to hire additional staff to be able to respond to that capacity, that need for capacity. We've been encouraged that there's been some funding that's come down from the federal government to help support crisis call centers. We and our partners helped to push for a state allocation for national suicide prevention and crisis lifeline providers such as BCRI. So there is $5 million in the FY2023 state budget, that some of which will go to BCRI. And we also passed legislation to establish a 988 trust fund. I'm not sure if members of the committee are familiar, but Congress passed a law to establish or to transition the National Suicide Prevention Lifeline from a 10-digit 1-800 number to a new 3-digit number 988 to parallel 911. And that transition occurs next month in July. And so in preparation for that, that's where some of the federal money is coming from. And we established a trust fund at the state level to help reimburse localities to invest in their crisis services. So that's some of the things in the crisis call center realm that we're trying to do. We're also trying to reduce our reliance on law enforcement for mental health crises. We work closely with city fire and 911 systems on the 911 diversion pilot that's going on, and we hope to see that expand in coming years and months. We're also working to establish a regional crisis response system, which will allow us to pool our resources across several counties in the city and invest in additional mobile response teams and additional urgent care appointment opportunities. So if somebody needs to get medication or needs to talk to a counselor, they don't have to go to the emergency room to do that. They can get in same day or next day. So we're working on all of that. I think we support the Kerwin legislation that's going to invest in additional mental health resources in our schools. We have the Crisis Stabilization Center that we're continuing to support as an alternative to emergency rooms for people who are experiencing a substance use or opioid crisis. So, we're trying to continue to push on all fronts. I think one of our challenges right now is with workforce. I think that's a key thing that makes it hard to scale up services, even when there's a lot of funding that is available out there. But those are some of, just off the top of my head, some of the things that we're doing to try to respond to this crisis.
No, I appreciate that. And, I'm glad you brought up both GBRICS and BCRI. I think that GBRICS, we're all excited for it. I think it's really the right approach, a regional approach, leveraging hospitals. I will say, though, that with BCRI, it is my contention that prior to the current executive director coming on, that organization was really in crisis. I mean, it just, folks would call and not get through. Folks would call and speak to an operator, and then a mobile unit would or would not come out. Often they did not. I thought the follow-through was really poor. I've had huge issues with BCRI, and I will say that I think since Jonathan Davis has come in, I've seen vast improvement just in basic operations, in follow-through, in data tracking. So I'm really glad that he is here. However, I am of the belief that it is still drastically under capacity. That, to your point, to the commissioner, that we are just seeing folks all over the place. And if we as a city are serious about not just calling the police when we see mental health crises, we have to fund the alternative system. We have to make sure it is robust enough that when it gets to July and someone does that 988, that there's actually someone coming. Otherwise, it is just incredibly dispiriting for residents, right? Like, I went through this whole process, I called here to help, and no one came out, or they didn't, they weren't able to support the person. And there's no magic solution. We all know behavioral health crises are extremely difficult. It's not a quick fix, but I do believe that it is a best practice around the country. It works, and that Baltimore has the potential to be a national model once again. Just given our hospital infrastructure, given our public health infrastructure, our mayor's focus on this type of work, I just think that this body, our mayor, the entire, all of us need to do more to support BCRI. That's something I have put in writing to the mayor. That's been a recommendation of the Trauma-Informed Care Task Force. I just believe we are leaving folks behind right now, and that's a shame. And so again, I just want to put on record that I think we all, BHSB, us, everyone has to do more. We have to make sure anybody that is having a behavioral health crisis gets an immediate response, and that there are folks available, be it nurses, clinicians, folks with lived experience, the whole team. And I believe it's about a $3.5 million gap. That's what I've articulated to the mayor, and hope that you all BHSB will join us in pushing for more funding for BCRI in the short term, not just when GBRICS gets here.
Sure. Well, we couldn't agree more that we want BCRI and our entire behavioral health crisis response system to be well-funded and to have more capacity than it has today. The last thing you would want is someone who's in suicidal or other type of behavioral health crisis to feel the need that they need to reach out for help and not get the help that they need. Like you said, that's absolutely what we want to avoid. And we absolutely agree that we want to see BCRI receive more funding. Like we said, the $5 million that was able to be earmarked in the governor's budget for FY2023, we think that's a good first step, as well as some funding that's come down from SAMHSA. And GBRICS, the Greater Baltimore Regional Integrated Crisis System, for those who are unfamiliar with the acronym, that's not that long term. Like we're about to start providing new funding for call centers and for new mobile response teams that can go out into the community and meet people when they're in crisis. So So we couldn't agree more, and we want to see anyone who's having a behavioral health crisis get a prompt and dependable response.
Great. I got more, but I don't want to hog the mic, so thank you for the responses, and thank you, Mr. Chair.
Thank you. We've been joined by Councilman Mark Conway, 4th District, Councilwoman Porter, and real quick, Sophia, when we get back to me, I'd like Director Mayhew from Government Relations here because I want to have an in-depth conversation about the board at Animal Control. Thank you. If you could get her, please, queued up. Thank you. Councilwoman Ramos.
Thank you, Mr. Chair. Thank you, Dr. Terraza. And obviously, you and your team have just been amazing and have spent many nights, many days, many hours to keep us all healthy and safe. So thank you very much for that. I had a follow-up to, first of all, I wanted to second what my colleague from the 1st District was talking about. This is BCRI and the work that is needed. It's critical. And so I want to make sure that, you hear and the mayor's office hears that, the additional funding is going to be crucial to make sure that BCRI has the capacity that it needs to meet the growing demand. And frankly, it's not just, I've had great, experiences with BCRI when a resident says to me, hey, my next door neighbor's in crisis, can someone go check? And we actually avoided a massive problem because we had already done that check-in work. So it's critical, obviously, for 911 diversion as well. So just, again, whatever you need to make that happen, let us know. My first question is, last year you had reported, Dr. D, that the department is 80% grant funded. Is that still the case this year?
It's about that. I'll look to my Chief of Finance and Administration to see if there's been any major shifts, but it's usually about that.
Good morning.
Good morning.
Honorable Council. Yes, we have approximately 80% grant funds.
80% grant funded. So that's, all of the HIV money, the senior money, so, because all of these federal line items are pretty big. So, and obviously you're able to stack and braid and integrate, as you need. But that's still pretty significant because grants are grants. So it is something that we're going to have to think about moving forward. So, but obviously your grant team must be amazing because the grants keep coming in. So that's wonderful. And but it is still something that is concerning in terms of making sure that the agency is sustainable moving forward. And then my second question was a follow-up to Councilwoman Porter's. Kerwin is, I don't see an uptick in the dollars under the school nurses. Is the Kerwin money for school nurses and social workers that you all would be supporting comes from the school system, right? So we wouldn't see it in your budget? Is that what's happening, or how?
I believe so. So we have a contract with city schools to provide school nursing. So I don't know that it would come through us. I don't know if you know, Leslie.
I'm sorry, repeat that.
The Kerwin funding.
Kerwin funding, because I didn't see an uptick here in the budget given we're providing more money and so is the state.
That money is funneled through the Baltimore City public school system.
The schools, okay. So it wouldn't necessarily be reflected here.
It wouldn't be reflected in our budget, but the requirement to have a clinical provider, typically that might be contracted through our school health services. Does that make sense? So there's a requirement that there be a clinical provider.
Yeah, there's a requirement to have a clinical provider at every school under Kerwin, and you're providing that service.
If we can find individuals to fill those roles.
Okay, sure. So that's right. We had the long conversation with Dr. Santalisa about that as well. But I just didn't see the numbers reflected in here. So
Just like the ed that's from Baltimore City public school systems through our school health program is about $3 million.
$3 million, did you say?
Correct.
That's currently funded by the school system. And how much is it going to be once Kerwin kicks in?
That's with Kerwin.
That is with current?
Yes.
So 3 million in addition to what you get now? Okay, I understand, thank
Yes.
you. Okay, 3 million is a lot, but it's not. So, obviously, whatever help you need on that is also important. Just because I've seen it in my daughter's school, how important a clinical person is, especially now. And in some of our schools, like I have the biggest school, public school in the city, Mervo, I think we need like 4. So it's a big deal. I have more questions, Mr. Chair, but I'll yield for right now.
Thank you, Councilwoman. Councilman Conway?
Thank you, Mr. Chair. And I don't really have any major questions. Maybe just 2 points. One, to agree with my colleague from the first and his comments about BCRI and its importance. I know I've come across a number of instances in my district where I've had constituent issues, and I know that would be a really helpful tool, and it's not always perfect. I know it may take some time to get there, but I do agree with his sentiment in making sure that we can help that organization as best as possible to meet the need across the city. My second point is I just want to appreciate you. I appreciate you and your team for the work that you guys have been doing over the last 2+ years to keep us informed, keep us healthy. I think the city has done far better than anyone expected and far better than many other cities as a result of your leadership. So I just really want to appreciate you. So thank you so much, and I could appreciate working with you.
Thank you.
Sophia, I want to remind you that I'm very anxious to discuss my severe dissatisfaction with the Animal Control Board. So if you could please remind Director Mayhew that, again, I'm very anxious to talk about that topic. Dr. D, can you tell me, well, I'm going to hold off on that topic. I'm certain that Director Mayhew will be here momentarily. One issue that I had raised to you, and I think, can't remember if Director Mitchell was here or not, and maybe it was last year or the year before, was around 2 issues that are somewhat related to health and DPW. One was the collection of needles, and the other was the collection of dead animals. Would your office be willing to do some research over the coming months and, let's say, get something back to the committee by September 1st regarding what it is that other major cities in the United States do around the collection of dead animals and the collection of needles?
Yeah, I can answer. I'll start with the needle collection question. And so a few months ago, when you initially brought that issue up, there were some convenings between health, DPW, the mayor's office, and Bureau of Procurement, because in many other cities, there's often a contracted vendor who may come in to support needle collection. And so there was some discussion around perhaps a pilot that would, I believe, be run out of DPW, where they would contract those services out, and those individuals could eventually train DPW staff, when we have also done some trainings of DPW staff. So I can certainly follow up to see where they are in that process, but my understanding was that they were going to pursue, DPW was going to pursue a broader pilot that brought in a contractual group to do the needle collection. With regards to, I'm sorry, go ahead.
Can you go back to that? Because I've raised this issue a number of times.
Yeah.
And of course, I'm hearing it from you for the first time, which I appreciate you letting me know. But I'm kind of shocked that I haven't heard this from Department of Public Works. So you said that they are exploring bringing on contractor support.
That is my understanding, yes.
And that's for needle cleanup.
That's for needle
Counsel.
cleanup.
I'm sorry, can I interject real quick? So Deputy Mayor Faith Lee, so this is something that I'm working on. So hazardous waste, we're trying to include hazardous waste like human waste, but also needles as well. And so Deputy Mayor Leach is actually working to bring on a hazardous waste contractor, as Dr. D just mentioned. So that is in progress based on the work we're doing in Berry Circle. So that is in progress.
Well, we can move on from that. I want to thank you for your work with that, Councilwoman Porter. I'm in support. No. I'm in support of safe injection sites, but if we're going to have that, then we need to clean up after it. So I really appreciate your engagement on that, Councilwoman.
And I'll mention maybe one other thing. And so again, around this topic, our staff has been in contact with New York City, so partners in New York City, to understand how they kind of manage with many of their syringe exchange service programs. Because you have to recall, we are just one syringe exchange service provider in the city, right? And so there are nonprofits who are approved by the city, by the state, but we know that we have other partners in this space, and so making sure that they're informed, and so we're, again, thinking through how do we work with those partners to also make sure that they're, kind of doing their due diligence and their part to maintain safety and cleanup in the areas. So I think the pilot, will be interesting to see how that goes.
Yeah, and it was more kind of a broader approach, because I was concerned that, there were persons experiencing homelessness, using bathrooms outside, and so we realized that there wasn't a hazardous waste contractor in the city, so you all are not responsible, DPW is not responsible, DOT is not responsible, and then you have to ask the question of who is. And so that prompted the kind of research and execution for that. So it is on Deputy Mayor Face Leach's list to do. I believe they're in the contract stages with BOE, so it is like.
She mentioned it the other day.
She did. Yep. So. But it's a broader approach to hazardous waste, not just needles.
I'm of the mindset that residents should be able to call 311 when there's a needle on the ground, and someone should come pick it up, recognizing that's a very hazardous and dangerous job. Sophia, if you could please, and I don't know if Nate's in here, I'd like follow up something in writing from Deputy Mayor Leach by no later than call of business this Friday, with a brief narrative explaining what the status of those efforts are per Councilwoman Porter's description. Dr. D, can we jump over to the collection of dead animals?
Sure. So I will defer to Mary Beth, who maybe has a little bit more historical knowledge on how we typically manage that.
And specifically, when we talk about the collection of dead animals, I'm very interested in the collection of dead rats.
Yes, I understand. Thank you, Councilman. Historically in Baltimore City and in other cities, dead rat pickup has not really been a function of government. It's based on the size of the animal, the relative prevalence of the animal.
The relative
prevalence of the animal, as well as efforts that are undertaken for rat eradication, which results in dead rats. In addition, any animal really that's under 5 pounds is not part of our animal control, Office of Animal Control, dead animal pickup.
Can you please repeat that sentence again?
Yes. An animal that is...
Mary Beth, can you speak up? Yeah.
Yes. An animal that is under 5 pounds approximately would be disposed, for example, if you had a pet bird. Animal control would not come out and collect the bird. You would be advised to just wrap it and dispose of it in your normal consumer waste. So any animal under 5 pounds, that would be the method of disposal. Since no one really owns the rats, they die, their bodies are where they are, they decompose. It takes about 3 days for a dead animal pickup call, and that would be for a normal, larger animal where we would go out. During the very, very busy season, we can run it even 7 days. It's not the highest priority of call because we have calls such as animals in danger and at risk. Animal hit by a car at an intersection would be an example of that. We have standby for police department, sheriff's department, where perhaps they're executing a warrant, but there's a dog between them and the person they are trying to arrest. Those are a very top priority call. Dog bites, coming to the scene of those are priority calls. But the dead animal pickup is literally just the end of the road, the pickup at the end. We do come out if we have someone who has a large animal on their own and maybe they can't handle its disposal. We would come to their home, but in general, that isn't a service that we provide. It's something that the constituent would take care of. We used to have a service, but it was cut in 2013. We had 2 drivers. They were then called chauffeurs as the classification. Both of those were cut. And that meant that the burden of dead animal pickup fell solely on all of the other officers in the Office of Animal Control. We're presently running at about 3 days for dead animal pickup. But again, for animals under 5 pounds, we don't go out for that. That's not a service that we're able to provide.
I guess they had that job classification because they were chauffeuring the dead animal.
I can only guess as to.
I don't
Where
mean to
that,
force you to
you know.
speculate like that. I do wish the Baltimore City Health Department was available when the New York Mets star pitcher Max Scherzer was bit by a dog a few days ago, but I recognize your jurisdiction ends at the county line. When we talk about above 5 pounds, that's anything, a raccoon, a dog, a cat, a fox, whatever, above 5 pounds.
Well, for wildlife, we don't necessarily pick up dead wildlife either. Again, we have a lot of incursion into the urban area of wildlife as the built environment increases. This isn't something that the Office of Animal can handle in terms of any kind of a volume. If an animal is in the public way, however, we would go out to remove it from the public way.
Excellent. Yeah, most of my foxes and raccoons in Central West and South Baltimore are fairly healthy, so I'm not too concerned for them. More of my focus on the rats, which are under 5 pounds. Okay. Well, I take back the previous Sophia and Nate. I don't need any research on the needle issue. We're also been joined by City Administrator Chris Shorter, and Mr. Administrator, it's my understanding that Deputy Mayor Leach is working on a procurement for a vendor to collect needles. So I'm very encouraged to hear that. Councilwoman Porter and Dr. D advised me of that. So that's outstanding news. I really appreciate that because I know that's a topic that we've spent some time talking about in the past. So let me modify my request regarding dead rats. Could we do some research? Could we do some research as to what it is other cities are doing? I know that you may consider reaching out to the city administrator's office because I know he had, at a minimum, some preliminary research for me last year around this issue as to what other cities do around rat collection, if I'm not mistaken, or dead rat collection. But I'd just be curious to get a snapshot of what it is that other major cities are doing. Would say by October 1st be a reasonable time frame?
Yes.
If you need more time, please let me know.
Thank you.
Colleagues, I know that I've asked 2 questions, but I've just been dying to talk about the Animal Control Board. And Director Mayhew is here, so if that's acceptable to the committee.
And Mr. Chair, I just wanted to clarify, so it's not just needles, it's all of hazardous waste that's, okay, just want to clarify.
Director Mayhew, if you could come on up and join us at a seat with a microphone. Can someone please tell me what the name of what we commonly refer to as the Animal Control Board is? I don't see that listed on the mayor's office website for boards and commissions.
Yeah, so again, I might defer to Deputy Commissioner Haller.
It's the Animal Hearing Panel.
It's the Animal
Animal Hearing Panel.
The Animal Hearing
Animal
Panel.
Hearing
Hearing Panel.
Panel?
Hearing
Panel. And I don't see that listed on the boards and commissions site. Who's on that? Who appoints it? Can you tell me a little bit more about it?
They're recommended. It's made up of attorneys, individuals with animal behavior experience. They're contracted out. They're contracted.
So they're paid?
Yes, they're
Compensated?
paid. They're paid and out.
Similar to some of our other boards, such as Environmental Control Board, Zoning, Liquor, in most cases Planning Commission, right? How do those individuals make their way onto that board?
Typically through resumes.
Through
Resumes, and resumes are vetted.
So
Recommendations, resumes.
it's health department that selects, or animal control who selects who's on that board?
The Office of Animal Control
The office of,
selects. For example, right now we have 5 animal hearing panel members, and we're looking to hire a 6th.
You're looking to hire 6 more or
No,
a
a sixth.
A sixth. A sixth.
They rotate duties, for example, depending on what the transgression is, or the discrepancy. If, for example, it could be an unlicensed animal, but a hearing is requested. That would be one hearing officer would hear that case. If it's a dangerous or vicious dog hearing, however, that is a three individuals are drawn from the pool to hear that case, to hear those cases.
Do we know of any other board and or commission in Baltimore City in which an agency reviews applications to determine who the members of that board or commission are without mayoral appointment? I find it quite interesting that we have an entity performing this function that is not controlled by the mayor's office.
The animal hearing panel isn't set up in Article 1 like other boards of commissions. It's actually part of the health code. And then there's a regulation that governs the operation of the panel.
So
that's why it doesn't go through, sort of that appointment process. Recommendations, contracts are done through the BOE.
Councilwoman Ramos?
I'm sorry?
Councilwoman Ramos?
Sorry, Mr. Chair, I just was curious. Usually when something like that happens, it's regulated by the state. Is that state article that you were referring to, or city?
Baltimore City Health Code.
It's the health code, so that is unusual.
So do we have, can you get me someone from law department to come up?
Yes.
Thank you. But please stay, because I'm very interested in discussing this. So, if you, I'm sorry, Director Mayhew, if you could please go get someone from law department so we could talk more about this, and I'll come back. I'll cycle back through in the order that we did before. Councilwoman Porter, so we will come to her as soon as she gets back. Councilman Cohen.
Thank you, Mr. Chair. Thank you, Commissioner Drassa and team again. I do want to reiterate a point my colleague made about the fact that 80+% of your budget is grant funded. I think that is tragically too high. I think we've all seen the need for public health in this last couple of years, and we as a city should do more to invest in this work. I am curious how you are thinking about, as we see potential rise again in COVID cases and start to see just more of a wave coming. How are we gearing back up in terms of testing, in terms of vaccination, revaccinating folks, boosters? Could you just give a snapshot on how we're thinking about that, and almost more importantly, how we're going to pay for it?
Sure. So I'll first say how we're going to pay for it. So we are very appreciative of the ARPA funding, which we do have about $26 million for this fiscal year, which will help support those ongoing efforts. I would like to say, I don't know that we've truly geared down, right? And so I know we talk about gearing up. I think we have certainly shifted, but one thing I'll compliment the team is that they have been able to adjust as I think the needs of the pandemic have adjusted. And so certainly as we think about ARPA spending, even for this upcoming year, we'll be constantly looking at what are the specific needs. We continue to host testing clinics and really never stopped having testing, throughout the pandemic, even in times where we've seen a lull. Likewise for vaccination, we host alongside partners, typically 20+ vaccination clinics a week in areas that have the lowest vaccination coverage. We know that a lot of our focus also has to continue to be on messaging as we see the need for boosters in older adults. Boosters recently approved for 5 to 11, and subsequently we'll we'll see vaccinations approved for under 5, likely later this month. And so working within our current structure, I think we're able to expand as needed as those needs shift and change. So even in thinking about immunizations for children under 5, we've continued to run immunization clinics for children. So this summer we'll be promoting obviously COVID vaccinations, but certainly many of the other childhood vaccinations that many kids have fallen behind on. So I'd like to think that we have been able to kind of shift as we've seen needs change, and we will have some additional, ongoing support from the ARPA funding to keep the response going.
Great. Hope so, and hope this pandemic ends sometime soon. And also hope that we can vaccinate 0 through 5 soon, because I got 2 of those folks running around. Second question, I asked last night to the Mayor's Office of Neighborhood Safety and Engagement about issues which I think are really plaguing our city around overdose deaths, which I think, as was mentioned before, have really skyrocketed across the country during the pandemic. We know more folks are substance dependent. We know that we were and remain ground zero for the opioid crisis. We know that tragically we treated it as criminality and tried to mass incarcerate our way out of it, and that we are living with the results of that horrific set of policy decisions. I think that we've all come to a recognition that addiction is a mental health issue and a public health issue, and that trying to criminalize it is both immoral and just wrong on a number of levels. Really proud in the partnership with Healing City that we've been able to put some peer recovery coaches in the Penn North branch of the Enoch Pratt Free Library. Big believer in harm reduction around substance use and peer recovery as a vehicle. But I want to ask specifically about that question because I think it remains a crisis, and one that we don't talk enough about in this city. We talk a lot about the numbers related to murder, but we see almost 3 times as many deaths from overdose. So can you talk about your agency's sense of urgency as it relates to that crisis, and how do we, develop an infrastructure that is really responsive to the need? Because I think one of the frustrations that I hear from people is, okay, we get it, we're not going to criminalize anymore, we're not going to, we're not going to throw people in jail. We know that didn't work. We know it was a failure on a number of levels, but what replaces that? And I think that's a really important question, not just for Baltimore, but for every city in the United States. So I'm curious about, how we're thinking about developing just a robust infrastructure around supporting treatment, around supporting people struggling with addiction, and around preventing deaths from overdose.
Sure. So maybe I'll start, and certainly Daniel, if there are things that you want to speak on as far as BHSB's role, that would be helpful. One of the programs I didn't necessarily spend a lot of time talking about, though, but is our mobile spot van. And so if you recall, some years ago, there was a lot of talk around a hub and spokes model, where there was an opioid use disorder treatment center that served as kind of the central hub, and that there were spokes that also could provide treatment. And so some years ago, we established our mobile spot van that actually, similar to our syringe exchange vans, is in the community and can start residents on buprenorphine, but also can do wound care management, hepatitis C treatments, HIV testing, and treatment as well. And so I see that as a really kind of pivotal way that we can meet residents where they are. During the pandemic, they actually transitioned to telehealth to deliver those services for a period of time, and had greater retention of clients in transitioning to telehealth. They're now back in the communities, but I think we really have to meet people where they are if we want to be effective, and we have to be present, right? And so I think being that constant, I think the residents get to know members that work on the mobile spot van, and that has been pretty critical. And for any residents who are more complex and need additional support, they can always be referred back to the hub. Those individuals can get referred to treatment centers. They can get referred for primary care. So it really is kind of this comprehensive place to support substance use disorder, again, in an environment where residents are comfortable meeting them where they are. So I think that's an example. It's one example. Our team obviously also works across the city with multiple city and state agencies on our opioid intervention team and our overdose fatality review team. And so talking about OIT, that is supported and mandated by the state to really look at creating a robust strategic plan around supporting the overdose response work. It has to be a multi-agency effort, so that does include even law enforcement agencies. State's attorney is a member of that group, fire, police, to make sure that we're kind of aligned on what our strategic priorities are. And so that is kind of the body that makes those general recommendations. The overdose fatality review team is very similar to our child fatality review team, where they do a retrospective review of cases of residents that have passed away due to opioid use. And similar to our child fatality review team, they're looking for potential policy solutions that could have prevented that person's death. So one such result was, I think it was in 2019, we supported legislation at the state level that will require local corrections to provide substance use disorder treatment in the jails. That goes into effect this year. So 2023 is when that goes into effect. So that's huge. We know that there is an increased risk of overdose post-release for this particular population. And so I think that's certainly another way where we've really tried to support addressing opioid use disorder at the policy level. But certainly, Daniel, if there are things that you...
Quick, Dr. D, when you say in the jail, so central booking, are we also like Jessup?
DPSCS, and yep.
Got it.
Yep.
And I'm actually going to turn it over to our Vice President of Operations, Lynn Muma, for that answer.
Good morning, Lynn Muma with Behavioral Health System Baltimore. I appreciate the question. It's something that we talk about a lot at BHSB, the burden, the enormous burden on this city from the overdose deaths. It's enormous, and it's been too long that it's been going on. We partner closely with the health department, which is the lead for the overdose response as the public health entity for the city. We partner with the OIT that Dr. DeRosa referenced. We think about prevention in multi-layers, multi-levels. We think about prevention of death, and so we are doing a lot of harm reduction work. We have our Be More Power outreach workers who are doing harm reduction outreach regularly throughout the city, throughout the week, every week. We have a Maryland Harm Reduction Training Institute, which is training around with partners throughout the city and the state that around harm reduction philosophy and protocol. We think about and we work to support treatment, access to treatment, and so some of the conversation earlier about the work around the crisis system infrastructure is certainly part of that response system and important. We work with the providers. Our role is to be overseeing and the providers across the city that provide substance disorder treatment services, and we're partnering with other areas of work that Dr. DeRosa referenced in terms of the hub and spoke, kind of building out infrastructure to engage people who are ready for treatment into treatment. And we think about primary prevention, which is our substance use disorder work and with young people in community and in schools.
Great. No, I appreciate it, Lynn. And BHSB one area where I would suggest there's some room for partnership, as we were training the library system in trauma-informed care, Director Daniel, who's the head librarian, recognized as we were looking at policies that they still had sort of a zero tolerance approach, and she felt that was anachronistic and inappropriate, just given, again, the shift that we're trying to make toward public health. And so she opted to get rid of that policy and instead bring peer recovery coaches into the library. We've started in Penn North. She and we are seeking to expand it to many other libraries throughout the city. I would suggest that those are the types of spaces that we should be engaged in. I would say libraries, I would say rec centers, potentially. I would say barbershops. We talk about meeting folks where they are. I think sometimes we leave these types of spaces on the table. But what we've seen is that because it's non-stigmatizing, it's not pathologizing, it doesn't feel like, someone is judging me if I just go and engage with this person who's my peer, who's been through this, that it can have real results. And so I would, again, just suggest that I think there's a lot of opportunity to really be creative and really partner with groups like More Than a Shop and others that are in community in a very deep way, and can be advocates and can be sort of a bridge to this tricky, at times thorny conversation around what it means to recover. We have some great peer recovery groups in this city. The Maryland Peer Advisory Council, which I think is phenomenal, and again, would love to see just some deeper partnership in that area.
Can I add one more thing? Not to cut you off, Lynn, but you may even want to talk about the work of the Crisis Stabilization Center, because I don't know that we've mentioned that yet, which really started as trying to divert individuals who, showed up to the ED, whether they had experienced a non-fatal overdose or were intoxicated, so that they didn't stay in the ED, but subsequently could go to the Crisis Stabilization Center for observation by clinical professionals. They do allow starting of treatment and can refer those individuals out to long-term treatment programs as well. So it's probably worth mentioning some of the successes of that program too.
Sure. Yes, it has been in operation for several years now, and there is a real effort on connecting people to treatment, and we've seen some progress in that area. I'm not sure what else to say.
So, and I could be remembered that at one point, you all would follow individuals for at least kind of 30 days to understand how many people have been connected to treatment. I don't know if you still had those stats.
I do not have them right off the top of my head, but would that be helpful to get that back to the committee? Can do that. Sure thing.
Sure. Yeah.
Would you like to ask your questions, or do you want to talk about animal control?
I have animal control questions.
Really?
So-
Animal control. Ms. DePietro, thank you so much for joining us today. I hope all is well in the law department.
I can ask my
Always
law
appreciate your
degree.
assistance. You can take a seat if you like. This is a Snickers bar moment.
Here, I'll get you this one.
Deputy Commissioner Haller, please remind me the formal name of this organization.
It's the Animal Hearing Panel. It's the Animal Hearing Panel.
The Animal Hearing Panel. And Ms. DePietro, this is outlined in Article 1 of City Code?
Yes, I believe that's correct. Subtitle 55. The official name is the Mayor's Anti-Animal Abuse Advisory Commission. And you were concerned about the membership and how it was appointed, is that correct?
Yes, ma'am.
The code says in section 55-3 that there are 15 members that are appointed by the mayor in accordance with Article 4, Section 6, and then there are 11 agency representatives. There are some limitations on the appointed members. They are, in the next section 15, are appointed pursuant to membership in certain entities like the SPCA, the
Can we
ASP.
go back to, you said pursuant to Article 6?
Yes, Article 4, Section 6.
Councilman, yeah, I'm so sorry. May I interrupt for just a moment?
You interrupt all you want, but just please speak loud. Need everyone to speak loud with the masks on.
Yes. The actual, that's the section in Article 1 for the Anti-Animal Abuse Commission. That's the Mayor's Anti-Animal Abuse Commission, which does consist of that large membership. The Animal Hearing Panel is codified in the Health Code in Section 10-001.
Okay, hang on 1 second.
Right, I didn't get the appropriate name.
Everyone hang on 1 second, please. Okay, Baltimore City Code, and I'm going to, where? The Health Code?
Health Code 10,
What is that
Dash-
article? What article is that?
Article 10, or Title 10.
Oh, the Health Code for whatever, that's not your fault. The legislative reference does that funky thing.
Oh, the
No,
HE
It's
instead of-
fine, you guys don't have a number.
Yeah.
Apparently, they're moving away from the numbering.
Right,
Councilman Cohen, you would know that. They're moving away from the numbering of the articles.
Indeed.
That's a Dorsey question. I hate that idea, but that's another battle for another day and has nothing to do with your department. So I am in the Baltimore City Health Code now. Can you please direct me to where I need to be?
To Title 10, Section 1001, I believe.
Okay, Title 10.
And in there, it should say an animal hearing panel.
Give
is
me 1 second. Yep. Okay, I'm in Title 10. Where in Title 10, Mary Beth?
1001, I think.
So I see 10-105 is the Mayor's Anti-Animal Abuse Advisory Commission, which Ms. DePietro referenced. Say your code number again.
Let me see if I can look it up.
Subtitle.
Sorry, if you just give me a moment.
I don't want to do that.
Oh, subtitle 10.
Would get it done.
Okay, it's subtitle 10, Hearings and Judicial Review.
Subtitle 10, okay. So, 161?
Yeah, it's in the
And this is within the health code.
code. 161 of the actual pages, not the PDF.
161 of the pages, okay. So that's the definitions. Mary Beth, there's no subtitle 10 in here. It starts at it starts at subtitle 101.
This is subtitle 10, Hearings and Judicial Review, Part 1. It's under Title 10 in the Health Code, Animal Control and Regulation. I think that's what it's called.
Okay, subtitle 10, Hearings and Judicial Review, on PDF page 218, or hard copy page 218. Okay. And then I'm scrolling down. Okay, so this is all hearings. So there is an animal hearing panel in the department.
That's it.
Panel comprises of at least 3 members appointed by the commissioner. Members of the panel must have expertise in animal behavior. The term of a member of the panel is at the discretion of the commissioner. Dr. D, you've been with us for 3 years.
Over 3.
Have you appointed any of these in your time that you've been here?
I don't know that I have. I think we've had the same members, but Mary Beth certainly.
I would have to check to see if we have new membership during that time. I don't know if we've added on during COVID, in all honesty.
Do we have a roster of the names of the people on that?
Not with me, but I can obtain it.
Okay. Could you please provide me a roster of names that are currently on it
Yes.
and when they were appointed to it? Dr. D, can we as you know, I'm very displeased with the performance of that board. Could we please connect offline with the mayor's office to talk about your appetite and or opposite, whatever your position is, to recodifying that entity so that it is appointed by the mayor of Baltimore and confirmed by the city council?
Yeah, we can talk.
Okay. And Elena, do you see any legal limitations to making it so that those folks are appointed by the mayor? And of course, the mayor's not going to appoint them without input from his health commissioner, right? But they should require city council confirmation, in my mind.
As long as they fell into
Can you please use a microphone? Thank you.
As long as they fell into the definition of municipal officer, I think that's the.
I can't hear you.
Can you hear me better now?
Much
Okay.
better.
The appointment authority of the mayor is generally reserved for municipal officers. I think these individuals would probably qualify as municipal officers, but I would have to check the definition more closely.
The mayor appoints
Almost every-
members of the LGBTQ
Right, so-
commission, the commission
Right.
on aging, the
Are
commission
you
on
talking
youth,
about the
commission.
commission itself or the hearing boards?
The
Panel.
folks that are making these, okay, let me
Are
take
they,
a,
do they serve as?
let me take a step back. The people that make these decisions should be confirmed by the city council. Do you see any legal limitations to us making that happen?
If they're not employees, it may be a problem. It would not necessarily a
Are
problem.
members of the LGBTQ commission employees of the city?
No.
But they come to executive appointments for
You're right, you're right.
confirmation?
No, but I don't see any huge problem.
Thank you
Unless they-
so much, Ms. DePietro. I appreciate it. Dr. D, I look forward to following up with you and the mayor's office on that matter offline. My understanding is Councilwoman Ramos has some more questions on this topic. Councilwoman Ramos.
Thank you, Mr. Chair. Just on the appeals, and then I have another animal control question.
Real quick, can we excuse Ms. DePietro?
Just for one, I just have a quick
Go ahead.
question, follow
Yes,
up. So it seems to me like the hearing panel is it like an appeals panel, or is it, no? So, because I was going to say that it would be sort of like the BMCA where we have it's an appeals panel, but in this case, they're actually making decisions about people who have vicious dogs, and I'm just pulling that out of the vicious dogs and what their penalty would be if they continue to have a vicious dog off leash, for instance. Okay. Yeah, it seemed, I'm not a lawyer, but it seems like it should be, I agree with the councilman, so, Mr. Chair. My second question, thank you very much, thank you.
Great. Thank you. Thank you, Elena.
Are you done with Elena? Okay.
Well, actually, real quick, Elena, Councilwoman Porter, do you have a question that requires law department here?
No, it doesn't.
Elena, you're excused. Thank you so much for coming up. We really
I have
appreciate
another
it.
animal
I'm going to
control
go back to Councilwoman Ramos, and then Councilwoman Porter also has a follow-up on this topic.
Sharon Miller and Animal Control, awesome, amazing, very responsive, doesn't have enough staff. I have, and I think 4 other of my colleagues have severe issues with unleashed dogs. And I'm actually going to be on the Stony Run by myself in the next few weeks to tell people to keep their dogs on a leash, because we don't have enough inspectors to be out there citing people. Now, normally dogs are very pleasant. I like dogs. I don't have one, but I like dogs very much. But a big dog approaching a little dog or a child in a public park is scary. And I know Rec and Parks is making efforts to put more dog facilities in the parks, and we're actually having conversations about that in the Stony Run. But that doesn't mean that people aren't going to have their dog off leash on the way there, right? So what are the plans to have this be a more robust entity, or at least to partner with the 5 new rangers that we're getting from Rec and Parks on this issue? Obviously, first we need the signage to say, no, you can't do this, and then we need the enforcement. I think we just need somebody there for 2 hours to cite people, and that word will get around. But we just don't have enough, and I think we don't have enough resources for all of what animal control is doing. Sharon Miller actually is really deep in a serious hoarding issue that we have in my district with lots of cats. And her compassion for this particular individual is outstanding, and she spends a lot of time. So I just want to try to figure out what's the thought there, because I see in the service that we have 20 people, but I don't know what they're all doing. Obviously, I don't know everything about the department, but I'm just concerned that we don't have enough help for her.
So maybe Deputy Commissioner Haller, you could speak to the roles of the staff that are present.
Yes, certainly. The breakdown of the 20 people, we essentially have 2 supervisors, and we have 15 animal enforcement officers. We also have a bite coordinator who looks into bite cases, and we have the director, Ms. Miller. The 15 officers are deployed for 3 shifts, and that is 24/7. Animal control does not close. So at any given time in the different parts of the city, you may have 1 or 2 animal officers trying to handle the entire area. And this is why it's so challenging, the idea of them being, in a park, kind of waiting for that misbehavior, which is, of course, human misbehavior.
Right.
It's with the priority clause that we have, it just isn't possible. I will point out that it is challenging, too, to ticket individuals. We don't have police powers. It's very easy for a dog owner to walk away.
Yeah, it's a challenging situation.
It's a very challenging situation.
Yeah, no question about it. And obviously,
Mike,
excuse me.
now that Councilman Torrance isn't with us, someone else was going to
Sure.
break the rule.
Yeah, it's a challenging situation. I certainly don't want to have police officers all over my parks either. So let's try to think about creative ways. I have been doing messaging, and I just don't want to spend time on dogs. I've got, there's a lot that we need to address in our city. So I'm hoping that we can keep doing messaging, keep nipping in the bud in some way. But I just wanted to express, we just need to figure out what to do. But also, very big fan of Sharon Miller. Thank you.
Thank you.
I do have another unrelated question.
Can we jump to
Of course.
follow up on? And I'm a huge fan of Sharon Miller. This has nothing to do with her. This is about that board and my estimation, poor decisions the board has made, which has nothing to do with health or Sharon Miller. Councilwoman Porter.
Following up on Councilwoman Ramos's underfunding issue of animal control, we're noticing that Barks is actually reaching capacity. And so they're having, with the stray dogs that are in our city, they are actually reaching capacity. Do you all have any partnerships with other animal control shelters to kind of funnel some of those animals to those shelters so that, we're making sure that we pick up stray dogs in the city, but also ensuring that they're not being euthanized in a way. Does that make sense?
Yeah, Deputy Commissioner Haller?
Yes, speaking for Barks, it's a little bit difficult to speak for Barks, but I can tell you that before Barks, when it was just strictly the city shelter and before it was contracted to a humane organization to be co-located with us, the euthanasia rate was extraordinarily high, above 90% higher. But it has since come down incredibly, almost without exception. It's the only shelter in the area that we have to take every animal that we receive. We don't turn away any animals. We would love to be, a no-kill shelter, as it's called, but when we must take every animal. Sometimes euthanasia is unavoidable. But the numbers are extremely small. I would have to reference
you're
those.
You're
but
exactly right. I did a tour.
It's
of Barks.
extraordinary
Yeah,
work. It really is with
what
limited
their-
resources.
Yes, ma'am. It's extraordinary what they're doing with such limited funding over there. My only concern is that the capacity of where in which they are and which they have as far as space, I'm not sure that it's accommodating in all of the stray animals that we're seeing in our city. And so that's why I'm a big proponent of the spay and neuter clinics that they do, pushing that out to the communities, but also ensuring that, as far as animal control, we're looking at other partnerships in other jurisdictions, because from what I understand, other jurisdictions bring their animals here as well. Is that correct? And so that's a bane. I mean, that's a stress on our city resources as well. And so I want to make sure that we're having those conversations with other jurisdictions that, we have space capacity issues here, and so how can we kind of mitigate that in other jurisdictions? So thank you for that, ma'am.
Thank you.
And before we go back to Councilwoman Ramos, we've been joined by Vice Chair of the committee, Councilman Robert Stokes, 12th District. He got drafted in earlier in the week. And also on that topic, Jen Browse at Barks is just fantastic too, so please pass that feedback along, although she already knows it. Councilwoman Ramos.
On a different topic, under the Healthy Homes piece, where you're working with obviously partners to detect lead and mold in a house, I didn't see, and obviously this doesn't have a lot of detail, but there's the remediation, but in some cases we have to relocate families. Is that what you're doing, or do you have Healthy Homes, Green and Healthy Homes relocate folks? What is that? What is the Healthy Homes? We obviously need it. We have a huge issue with kids with asthma and lead, and it's better than it was because we've been working so hard on it, but it happens. So are we relocating people as well?
So I would say thank you for bringing up Green and Healthy Homes. We partner with them. We also partner with Department of Housing. I think our goal is to not relocate if we can keep people stable, but I'll defer to Deputy Commissioner Haller if there are instances where we need to do that.
Yeah, the goal is to keep people in their homes. However, during any kind of remediation, relocation is necessary. If it is a rental property, it's actually the landlord responsibility to assist in that relocation. We also have housing programs that do remediation, and they work and deal with the relocation of the family during those renovations. We work with groups like Green and Healthy Homes, who offer great assistance in helping us find new homes for individuals that are lead safe. And then sometimes people return to the homes that they were originally renting. Mm-hmm. So we do work with other partners on that.
Mm-hmm. And is the indicator for that the testing of the child? Because I actually have two constituents with serious mold issues that I'm trying to deal with on a totally different subject.
Mold is really related to the asthma work that we do as being a trigger for asthma. We don't specifically remediate for mold because mold is caused typically by structural defect.
Yes.
So if the structural defect isn't repaired, the mold would just return.
Correct.
So we work with programs, housing rehabilitation programs with housing on some of those issues. In terms of, were you asking what the trigger for the inspection was? The trigger is an elevated blood lead level in a child.
Right.
And that's when we go and do the inspection, which is a comprehensive inspection.
Mm-hmm. It's not chronic asthma too, I thought? Or is it just the lead test?
We do both.
Okay.
The lead level would trigger, the lead environmental inspection. The asthma, but it is Healthy Homes, so we check for all of the triggers as well.
That's what I thought. Okay.
Yeah.
Right. Mm-hmm.
But we have separately, we have the Asthma Program, where we work with families who are Medicaid recipients. We receive lists on a quarterly basis of children who have uncontrolled but have been diagnosed with asthma. We go to the homes, we talk with the family, we work on an asthma management plan and educate the families, and we do return visits with them. The idea being, if a child has been to the ER, was then diagnosed, we then follow up, and the measure of success would be a reduction in the number of repeat ER visits.
Right. Gotcha. Okay. I just wasn't sure if there is that because we don't have enough money for relocation when there's bad landlord situation, which is an issue that I'm interested in working on. I have another question, Mr. Chair, but I will pass it along to others who might have other questions.
Thank you so much for following the two-question rule. Vice Chairman Stokes.
Good morning. I'm Dr. DeRiza. First, your staff and yourself are very responsive. I'm glad you're sitting there and still a commissioner here in Baltimore. I wanted to mention that our nurses in our schools, my question is, have you applied for any ARPA money? Because they've kind of been in the news on the forefront about the nurses in schools. My first question, have you applied for ARPA money, and is some of the money we need some nurses in these schools. We talking about mental health. I started an asthma program about 20 years ago. You still have asthma in schools. And, young people go home to mold. Asthma could be anything, carpet, roaches, all kinds of stuff. And when they come to school, if you don't have the equipment there, defibrillators and stuff, then that's a problem. So my question is, you apply for any ARPA money?
So we have applied generally for ARPA money to support other elements of the COVID response. However, on a good note, through our assistant commissioner's work with the labor commissioner's office, we were able to increase salary and bonuses for our nursing staff. So that will go into effect in the upcoming fiscal year. We are also launching a marketing campaign around nursing recruitment and retention, and we have received some state funding to support that.
So my question is, how many actually nurses do you have in schools?
So for exact numbers, I might defer to either Deputy Commissioner Haller or Assistant Commissioner Francine Childs.
So right now we have a combination of registered nurses as well as licensed practical nurses with a total of about 50 individuals. We are recruiting for additional vacancies, as the commissioner mentioned, and our intent is to be very intentional about filling those positions. But we also have about 110 school health aides, so the nurses are not working alone, as well as nurses through contracted agencies that assist us in providing those services.
Mr. Chair, can you send the list of the schools that actually have nurses and the ones that, I guess both, the ones that have nurses, the ones that have aides, and the ones that don't have nurses at all? I'm always glad to see our CAO here, because we go to him for money and stuff. So yeah, I want a list of the schools that actually have nurses and the ones that do not, and the ones that actually have, you said, health aides. Is that the same, or they just assist the nurses?
They assist the nurses. So school health aide might be similar to a med tech or medical assistant that you see in a doctor's office.
And I know y'all have to compete with the hospitals. I'm glad to hear that you're actually raising salaries, because that's the only way you're going to keep your nurses in the schools. My other question is, and I have mentioned this before, about the senior program, and I know it kind of fell into the health department. Myself and former city councilwoman Mary Pat, we've been talking about how do we create that cabinet position just for seniors, because it seems though it's in the health department. I remember seniors used to go on trips and they did ceramics, and it seemed like once that cabinet position kind of disappeared, that I only know it was the funding, but those programs, they are at some senior buildings, but some of the senior buildings I'm at, they just sit around and in the community centers, they don't have nothing to do. So that's why I have been talking about creating that cabinet position for our seniors.
Yeah, I think I'll speak broadly and certainly then can turn it over to Deputy Commissioner Tan. Older adults still remain a priority through the work of our Division of Aging. Our senior centers, there is variance in terms of how they're able to support Some of our senior centers are run by nonprofit organizations, and I think that sometimes allows them a bit greater flexibility in the type of programming that they can provide. But certainly one of I think the key things that we were able to do for our older adults during the pandemic was food and meal delivery. So we know that our senior centers were often congregate meal sites for many older adults. We quickly pivoted to make sure that we could provide those same older adults with food at home. So I think that was a major undertaking for that group, and we're going to be continuing that for some older adults that live in low food priority areas. Additionally, our COVID vaccination work was largely focused on obviously reaching our older adults first. And so not necessarily through our senior centers, though they have served as sites of vaccination and testing, but working with senior housing sites across the city. I think as you know, you were very supportive of this, going directly into senior housing sites through the work of our Division of Aging to vaccinate within the senior housing site. So I think that was really another critical part of our early vaccination efforts, doing that with both the flu vaccine, the COVID vaccination, and even going back for boosters. Anything else?
Thank you for your question, Councilman, and thank you, as always, for your advocacy and support of our older adult programming here. I think the Commissioner really highlighted a lot of the efforts and ongoing programs that we have here at the Health Department and Aging Services. The programs that you talk about around ceramics and recreational, they still exist. The senior centers opened to the public back last July, and they are continuing to open full-time, and we're working with our partners to do that. I think we've worked with your office to look into those 2 housing sites that you have concerns with, and I believe our Deputy Chief of Staff has responded to your office to increase outreach in those areas to make sure that services and activities and older residents there are engaged, and I'm happy to continue to work with you. Thank you.
Thank you. I will recognize Councilman Torrance, and I believe the councilman has 2 questions.
Torrance isn't here.
He told me Torrance. Oh. All right. Sorry, I must have been seeing somebody. Councilwoman Porter.
No further questions, Mr. Chair. Thank you.
You have a question?
I have one more.
Yeah. Thank you, Mr. Chair. Again, thank you, Commissioner. One question that I know is near and dear to my colleague over here and I is around reproductive health. In light of the leaked memo from the Supreme Court, we are pretty confident that Roe versus Wade will be struck down and reversed. That is obviously a crisis for our country, for states that will be likely to ban abortion. We know that West Virginia, many of the states around us are likely to fall into that category, and so we expect to see a large influx of women and other folks coming here to get reproductive health services. We passed a resolution unanimously in the council. We've been in good conversation with the administration and Mr. Shorter and the team on funding a fund specifically to support reproductive health. We have some great organizations in our city that are doing the work, but wanted to hear from you how your agency is preparing for this possibility and how the health department can really be, I think, a leader, but also a partner to groups like the Baltimore Abortion Project, Baltimore Doula Project, and others. I know you do a lot with Be More Healthy Babies already in the space, but just wanted to hear from you sort of how you're thinking about this potential shift where we could see a lot more folks needing to get support.
Yeah, no, absolutely. I think I agree. We're possibly heading into a crisis, and I think it's both. So currently we provide reproductive planning services at our East Side and West Side clinics. That will continue. If there are instances where an individual needs abortive services, then we refer out, and so we do have connections and relationships with providers who provide those services. So I think it's continuing that work, but it's also on the side of advocacy. Obviously, this would, legislation would be at the state level. So I think we would be working closely with our state legislative partners to ensure that right is protected for women, certainly in the city and across the state.
Most definitely. And any role in supporting training of reproductive health folks? I mean, is the health department, I know we have the different sites, but again, as we think about increased demand, are we able to support those who are going to be doing this increased amount of work?
So I think we can certainly support with messaging. I don't know that we've explored training. I might look to I think we have Assistant Commissioner for Clinical Services and Kathy Costa representing reproductive health, but I think messaging certainly will be key, but certainly if others or Deputy Commissioner Martin wants to chime in.
Thank you, Kathy Watson, Health Department. Thank you for the question. We are looking at change in reproductive health. We actually are still looking at it as a win and a lose. We're losing Roe, which I suspect we probably will. The win is that we'll be able to branch out to reach people who we are not normally going to reach. And outreach is a really important thing in getting to these services. And it's important for us to not oversell, but to also provide the best comprehensive and quality care that our population needs. It's not just for the women, it's for the men, it's also for the adolescents and young adults. Outreach is extremely important, but also a part of that is providing quality community and clinical care. We have good clinicians on staff, very dedicated, very responsive. We have excellent support staff who all have been with us during the pandemic. We actually went back into operation in the clinic 3 months after the shutdown and have been gearing up. And we will be trying to move closely to full operations come July, pending COVID restrictions. So yes, we are very much, working for that.
Great. Commissioner, I hope that as we figure out the city playing more of a direct role in financially supporting organizations doing this work, that you will very much be in those conversations, as I think you and your agency are a key voice and partner. So again, thank you.
Councilman, you good?
Yep.
Where did Councilman Torrent, did I see him?
No. You're imagining things. It's true.
Councilwoman Ramos.
Can I say something?
Oh, Councilman Story.
I think we were here too late yesterday, so the chair, yeah, I was here late. Not late as you are, but it was late. But the chair started seeing things, and I started seeing things he didn't see.
Marguerite just said he was here. I did not make that up.
Okay.
Thank you.
You good? Councilwoman Ramos.
Thank you, Mr. Chair. Going back to the senior centers, super important for our seniors, and I'm grateful that you're in areas that really need it most, I believe. I saw that the indicator for legal services was down. I think obviously COVID was the issue there. The senior centers are important for those of us, of our seniors who are aging in place. Because it provides them with a social interaction, et cetera, and access to important information. I am particularly concerned about the low rate of wills and estate planning that is happening, which then contributes to a lot of confusion once the senior passes. And so I'm wondering if you can talk a little bit more about the access to senior services, the legal services that you're providing at the centers. The indicator was about access to, and it's going to get higher as we get out of COVID, obviously. But can you talk a little bit about the legal services that are being provided there?
Sure. I'll defer to Deputy Commissioner Tan.
Thank you for that question, Councilman Romans. Senior Legal Services is funded through our Title IIIB federal grant, and on an average non-pandemic year, our volunteer attorneys close about 1,000 cases for older adults. We're about half now because the way that older adults access senior legal services are through the senior centers.
Yeah.
And so they remained, some were closed, but most of them are now open full-time to the public. I have to say real estate planning is really important, and there is a big push and campaign through one of our partners, through the Maryland Volunteers, Volunteers Lawyer Association, and Susan Francis, who has been a longtime member on our Commission on Aging, spearheads that organization. So we've been partnering, pushing these clinics out. It started about 2 years ago, knowing that this is such an important service, and really particularly for our most vulnerable communities. And so we're really trying to push that out. And I think, thank you for that question. And we continue to provide services and pushing that campaign through some of our media outlets as well.
Yeah, I think there's, in my district, we are working on a pilot to literally go door to door in my communities where there are mostly elders aging in place to ensure that they are healthy first, that they get the home repairs so that they can age in place with dignity, and do this critical estate planning. And we do have seniors that meet at the Rita Church Center. And I know some of your services dovetail there with the rec centers. It's just super important that we make sure those three things happen for our seniors aging in place, right? Certainly we'll keep you in the loop on how that's going to go.
And I completely agree in terms of the sequencing of those importance.
It's huge.
Yeah.
Huge. Also, want to make sure that we're pushing those services out, again, not just through the centers, but, all of the other ways. Maryland Volunteer Lawyer Service is definitely a major partner. So I appreciate that. Are you seeking volunteers to help with these kinds of partnerships? I mean, you've got the partnership with Maryland Volunteer Lawyer Service, but is there, other partners that you're seeking or you have?
We are. So the Bar Association conducts senior legal services for them, and most of their programming is reliant on volunteers.
Great. Yeah. Okay. It's just want to kind of loop you in on what we're trying to do in my district, because if we can do this right, and then we can scale it up. It's, again, super important for our older adults. So thank you. I appreciate that. Thank you, Mr. Chair.
Thank you. Colleagues, any other questions for health?
One more, Mr. Chair.
Floor is yours, sir.
Thank you. This is on behalf of our colleague who is not able to join us, the whole baby thing.
The whole person. We've got two of them.
Person, baby, all the things.
We got two of them, so you have to be specific.
If you're gonna sit on this side, you gotta
be specific.
You gotta be good.
Indeed. We've had two relatively brand new arrivals in the city council. All right, so question from Councilman Burnett, and this is a follow-up to the previous line of questioning around recovery and overdose. He said, can you, we've had constituents who have reached out to us who have had loved ones who have overdosed in recovery houses, and reports that some of these recovery houses are selling drugs within. How do you handle these types of complaints?
Great. I'll actually defer to BHSB as the oversight and regulatory agency for those entities.
It depends. Depends what the licensure of the residents would be. There's lots of, so it's hard to answer with one response. If there's a critical incident for that's reported on, a critical incident would be something that would be a danger to life. If that's reported for a treatment facility, that is part of the behavioral health network that we oversee, we would be partnering with the state to investigate. There's other kinds of residences that have different kinds of oversight that we would not have a role in, so it would depend.
Okay. Yeah, it does seem like a pretty underregulated space to me. You know, obviously high risk business, but to my colleague's point, I've also heard some great stories about recovery houses and some really bad stories about recovery houses. And I don't know if it's a lack of inspections at the state level or kind of where the gap is, but I do sense that there are some operators who are not doing right by the clients that they serve, who take advantage of folks who are extremely vulnerable, and who just don't provide much, and or allow folks to engage in behaviors that are detrimental to their recovery. So again, if you've got some thoughts on how to tighten that, I know obviously from more of a state issue, but if there's anything we can do at the local level, you know, I think it's important that we have very high standards for any recovery services, but particularly recovery houses.
We totally agree, and I appreciate the question. And there are some significant gaps in oversight, and that is something that we have had some conversation with the Behavioral Health Administration, which is part of the Maryland Department of Health. They lack a lot of the oversight authority as well for recovery residences, and in many cases. I don't have any immediate solutions. I agree that that's something that needs attention. I don't know what the answers are.
Just, again, I know it's more state, but are our housing commissioners, I'm sorry, losing my, sorry, we were up very late last night. Are our housing inspectors, like our local DHCD housing inspectors, are they engaged when there's an issue in a recovery house? Or do they not even go there?
Yeah, I think we'd have to ask them. I don't know personally, but we can maybe take that to
Mike.
Oh, I'm sorry. I don't know personally. We can certainly ask Commissioner Kennedy. I don't know.
Okay. Yeah, I'd like to make that a request. Administrator Shorter and folks would like to know sort of between health, housing, as we think about recovery houses, knowing that it's primarily regulated by the state, but that it obviously becomes our problem if they are not well run. What our sort of local capacity is around enforcement, whether it is indeed an issue with housing inspectors or not.
Really appreciate that question. They're actually, the law department actually has been working on rules around group homes.
Yeah.
And I want to sort of give them an opportunity to maybe respond to this formally with their path forward. I think there's a very specific set of recommendations that they have in terms of rules around group homes and how we can, as a city, provide for additional oversight.
Got it. And recovery houses would fit within that rubric as well?
They will.
Okay.
And this is less about programming and more about compliance. So look forward to their response.
Great.
Yep.
Do you know when that's coming down the pike?
They do have a specific timeline. I just don't remember right now in terms of rule changes. We've presented to. Do you remember? Yeah, I think we do. We did present to the councilwoman as well. So.
Thank you. Yeah, the work that we've been doing with the law department and housing on the group home issue is specifically for residences that is a group, but there is no treatment there, right? So it's a residential living facility. They are getting treatment elsewhere, but they're being housed. They're not recognized in the code right now. So we're recognizing them in the code, and also increasing the standards by which the actual building needs to be, because what they are treated right now as single-family residences. And yet we don't always enforce the building code. Now, it's not specifically about what happens when they're selling drugs in the place, but what we're trying to do is at least raise the standards by which the residents who are trying to go through recovery, we're trying to raise the standards by which the operators need to make sure that those residents are living in. Mm-hmm. And that, I think, that's pretty much the extent of our power in the city, because the facility itself is not regulated by the state, but the treatment they are getting is regulated by the state. So we are trying to work on this, and it'll be a piece of legislation, either from the mayor's office or from my office, that will at least help us with the enforcement powers that we have on, again, upgrading the facility, make sure they have all the plugs, the fire, sprinklers, all of that, because they are providing the service. So that may indirectly help us with the issue that the Councilman Burnett is talking about, but it certainly will help us with, I think, the other issues that many of us in our districts are having, because if the residents are not living in good conditions, then that spills out to the neighborhoods, right? And it also ensures that they're not getting, there are bad operators out there as well, right? So, and the key is understanding that we need treatment, we need the service, but we want to make sure that there are good operators. Right. And so that's where this is going.
And so we don't have the ability to revoke licensure, but
Mike.
Sorry.
Thank you.
So we do not have the ability, nor will we be able to revoke an operator's license, but we would potentially, per Councilmember Ramos and the work group's suggestions and legislation, be more active in regulating the building and making sure it at least is up to code and all that.
Correct, which I think will help us with making sure that we have good operators, because fly-by-night operators would not, the theory is the fly-by-night operators would not be able to comply with the new regulations that we're putting in.
Got it. All right, that's helpful. Thanks a lot. Thank you.
Yep.
Councilman Conway.
Thank you, Mr. Chair. And this issue is actually one I've also been working with Councilman Ramos on, but also it's related to another similar issue that is ever so slightly different regarding treatment centers, and the concentration of treatment centers within the city limits, and specifically along the city's major corridors. Similar to the issue with housing for folks receiving treatment otherwise, what we're finding is that Baltimore City in particular has a significant concentration of treatment centers, specifically within my district, along the York Road corridor. And so it causes some issues, and I'm not sure yet, and I guess this is a question for City Administrator Shorter, Have we begun to explore what options we can think about to make sure that we are meeting the need of Baltimore City's population with regard to drug treatment, but then also not being the only place in which these places open. And as I understand the problem, it's because of real estate. It's cheaper for folks to buy buildings and open buildings here for treatment. And that is, of course, a lucrative model. And so do we have, or have we been thinking at all about how to begin to resolve that issue similar to this one?
It is a very similar issue. I will say plainly that I do not believe we have any authority to restrict the number of group homes or treatment facilities in the city. Private operators can operate and they can buy homes without any barrier from the city. What we are attempting to do with this work that Councilmember Ramos is mentioning and that we are doing with the law department is to make the barrier to entry much more thoughtful. And so if you're an operator that is properly treating vulnerable populations, then you are going to keep your facility up to code. It gives us an ability to get into that home, to see what's happening in a much more standardized way. Currently, these facilities can operate without us seeing the inside of the building for 2, 3, 4 owners. Someone could move in, operate a program, lose that program, another operator could come in and the government not have seen the inside of the facility at all. What this legislation and work will do is allow for every time there is a change in owner for us to be able to see what is happening there. Anytime there's a change in the internal composition, whether there's an added room, an added restroom, we are in the facility with our inspectors. So it definitely gives us an opportunity to work better and to provide better oversight.
That's really helpful, and I think maybe a similar solution might be considered for the treatment centers issue as well. And I wonder, have we already begun to partner or coordinate with state level folks so that the things that the city does not have jurisdiction over, we are accurately checking for all the other licensures and others in those relationships?
I am out of my league on that one, so I think we'll have to follow up.
I would encourage us to think about that in as well, realizing there are only certain sort of zoning and structural things that we can consider as a city, and I think some of the more health-related stuff that can be handled at the state level, we would probably need a state inspector for. Yeah.
Can I say something real quick? Councilman, your Senator Mary Washington, they had a task force together in Annapolis to deal with treatment centers. You probably want to speak to her more, and you cannot do spot zoning with that. You cannot discriminate against treatment centers. We already had a lawsuit here in Baltimore a little while ago. So when we open up the CVS, whatever it is that distribute prescriptions, you cannot not even zone it out. Can't even zone out them coming into the building. That's from my own experience when they were trying to put the task force together in Annapolis. I mean, actually, when I was working with Councilman Carl Stokes, we were over at zoning, and the community wanted zoning before they issued that permit for them to open up that facility. They wanted them to let the community know. Zoning told them, get out of here, because they knew there would have been a federal lawsuit against them, discriminate against them. So,
Councilman, I appreciate that, and I apologize if I brought that up as like a solution. That certainly wasn't what I was doing, as much as just saying that the city only has control over certain things. And I think when it comes to the operation of these facilities, the city only has so much control over that, and it is something then that the state has to step in on. So thank you. Thank you for clarifying. Thank you, Mr. Chair.
Thank you. Colleagues, any other questions? Excellent. I forgot to thank Deputy Commissioner Tan, and it looks like she stepped out. So
She had somewhere to go.
please
Yep.
thank her for me.
Will
She's
do.
fantastic. I appreciate the
Yep.
responsiveness. Dr. D, thank you to you and your team very much. We're very lucky to have you in Baltimore. Appreciate all your
guys.
hard work. We're now in recess until
Thank you.
12:30, Department of Planning.